Glaucoma is a condition where the eye pressure is usually high and it damages the optic nerve, the nerve that connects the eye to the brain. So it can be a very dangerous disease. If it's not treated, you can eventually go blind from glaucoma. So it's something we need to take care of. Most patients with glaucoma can be controlled with eye drops. 85 to 90% of the time, that's all it takes. And as long as we can control the glaucoma, it usually doesn't affect the vision and you won't go blind. In some cases, we can do laser treatment that'll help with the eye pressure, and that's also an option. In some cases, if the drops aren't working or the patient can't tolerate them or the glaucoma is still getting worse, we can do surgery for glaucoma. Surgery for glaucoma basically is to make the eye pressure lower. We can do that a number of ways. The traditional way of doing that is a procedure called a trabeculectomy. What that is basically making a little drain in the eye to help the fluid seep out. It's not just a hole in the eye. We make it under the white of the eye so that the fluid seeps out in a controlled fashion and gets absorbed behind the eye. So it regulates the pressure in the eye by regulating the flow, and it'll help keep the pressure down. We've been doing trabeculectomies for many, many years. They work very well. But it is surgery. It's more invasive than cataract surgery because it does involve making a drain in there. And it takes a bit more anesthesia and takes a bit more time than simple cataract surgery. But it works very well. There's another newer procedure called a canaloplasty, which involves going into the eye's natural drain, which is called a canal, and threading a catheter through there and stretching it open. This is a newer procedure, requires some really high-tech catheters that are very tiny, like a hair, that we can put into the drain and open it up. This is a somewhat less invasive procedure because although it's still surgery, we're not actually going all the way into the eyeball itself, and we're not creating a drain, we're just making a new drain. It's kind of like an angioplasty for the heart. Instead of doing a bypass operation and putting a new vessel in to bypass a blockage, in an angioplasty, the cardiologists go in and stretch open the blocked blood vessel. So canaloplasty is kind of the same thing for the eye. So this is another alternative for patients with glaucoma if they're at the point where they may need surgery. There's some other procedures for glaucoma as well that involves shunts, different types of shunts and drains that we can put in there. Again, it depends on the type of glaucoma you have and how bad it is and what else needs to be done on the eye, but there are lots of options for glaucoma. The important thing is as long as we stay on top of it, keep it under control, we can usually keep it from causing damage to your vision. Glaucoma surgery is a bit more involved than cataract surgery. It does take a little bit longer. It's a little bit more invasive. There's more cutting and there's usually stitches involved. There is risk to it like any other kind of operation. Glaucoma surgery works the vast majority of the time, but it's probably closer to 80% rather than cataract surgery, which is closer to 98, 99%. If it doesn't work, we can do it again. We can do other procedures for glaucoma, so it doesn't mean that the eye is lost. It just takes more work. A lot of this just has to do with the way the eye heals. We have to control the healing in glaucoma surgery because if it heals too much, then the opening gets closed off again. We're back where we started from. So the trick in glaucoma surgery is really just to get the healing process controlled so it heals just the right amount. If we're doing cataract surgery, a lot of times cataract surgery itself will lower the eye pressure. So some patients with glaucoma, we may just take the cataract out and that may fix both problems with just the cataract surgery alone. But in some patients, if the glaucoma is bad enough, we know they may need glaucoma surgery at some point anyways. We'll sometimes combine that with cataract surgery and do both at the same time. There's some advantages to that because you don't have to go to the operating room twice, but it really depends on the patient. If we don't know that you're going to need it, we may want to hold off on glaucoma surgery and do that later. We can always do that at a later point after cataract surgery if we don't do it at the same time. Again, this is something that depends on the individual patient and what their glaucoma is doing at the time.